For the next technique, we're going to be doing the upper gluteal fibers just below the edge of the pelvis. This area tends to bind up when we have anterior pelvic tilt. So we're going to take our ball. We are going to lie on the ground and we're going to place the ball in that position underneath the hip. Now, what I'm going to do from here is cross my ankle over my knee so that I can kind of work through that edge there, releasing and trying to kind of break some of that tension up by applying pressure wherever I feel the hot spot. Now for some people it's everywhere. You can go as far as being nearly sideways like so, and you want to go all the way back, but the key is you want to stay off the bone. You don't want to be rolling on bone. Think of it like the shoreline. The muscles are the ocean. I want to be out in the ocean, but I want to be following the shore, kind of the way early sailors sailed. I want to be just off the shoreline, following it, so that way I can find the best points of tension to release. And I'm going to lean onto it. I can wiggle my knee if I want to. If you find that there's certain areas you want to lay your leg down for, you can do that. You can have both feet on the ground if that's more comfortable for you. But the key is, again, I'm not grunting and huffing and trying to do a bunch of crazy stuff. I'm just working on wiggling on that ball, trying to release tension from those upper gluteal fibers near the pelvis. It's really important. And again, we're doing 90 seconds on both sides. And I want to be inside my frame of tolerance. So not making faces, not grunting, not any of that. So then we're going to do the other side. So I'm going to show this a little bit different from the top down. So I'm going to cross ankle over knee, place the ball just underneath that outer aspect, and we're just going to work it this way now. Apparently my right is more sore than my left today. Shocker. It's not a shocker. You're going to find that certain patterns are fairly consistent for you. It can be based on injury or repetitive use, or sometimes some of us are born with certain features that just don't match up. Some people have a bigger ilium on one side than the other. Some people have congenital spinal deformities. Some people have had back fusions. Some people, have a cam disorder in their hip. All these different things are going to play a role in how the biomechanics work. And really all we are trying to do is release tension from the body and make space around the joints so that way we're not holding tension in weird ways that's causing poor biomechanics. And when it comes to anterior pelvic tilt, the key here is that we're trying to maintain a neutral pelvis as much as possible. And step 1 is getting the tissue released. Step 2 is mobilizing it. Step 3 is activating the inactive muscle structures so that when we stand up, we can practice holding a better position. But it's not just going to happen overnight. It's something that you have to practice and work at.